Welcome back to Healthcare in the Public Sector, sponsored by Verizon Enterprise Solutions on federalnewsradio.com and 1500 AM. I'm your host, Jason Fornicola, and my guests today are Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets. Nancy, let's start with you. There's a lot of confusion about what digital means, and yet it's pretty critical when it comes to the enabling of the kind of transformational healthcare that we've been talking about. What is it, and what will it mean for the future of healthcare?
Yeah, I think if you asked anyone listening or anyone in this room, digital would mean something different to everyone. You and I were talking about this before we started. And what it truly, for us, it looks like is this intersection between the network, technology, and information that, from a user's perspective, all three are coming together seamlessly, regardless of who that person is or where the user is. Right? So we've done a study around in healthcare, and what was interesting was that everyone in the space defined digital differently or didn't know what it meant. So this would be a service line of a cardiologist who thinks digital is a certain thing that has a lot to do with how they operate their business. Dermatologist thought something completely different. So when we look at it, connectivity is pointless unless it's intuitive. Right? So I've got all this point, I've got all this stuff put together, but they're meaningless if the right information doesn't come to the right place at the right time, and that's what digital means. In healthcare, we've done a lot of digitizing analog information when we went to electronic health records. They just scanned it.
Oh, go ahead.
No, that's okay. So if scanning it isn't what we're talking about now. That was back then. Now we have to actually add some analytics to it to make it help in the decision support.
All of these different definitions of what digital is that problematic, or is that just a sign of us still trying to feel out what it is and where we're going?
I think it's the latter. It's not problematic once you define it or have a conversation. I can have 14 different conversations and we all mean the same thing or can get to the same answer. I just need to know how they're framing it so I can understand that point of view.
And Peter, from your perspective on the federal side, a lot of this digital transformation adoption, tell me about that.
So beyond the rapid pace of technology advancement and innovation, there are really practical dynamics that are shaping the landscape in the public sector. Decreasing budgets, long procurement cycles for contracts, aging workforce, legacy systems that encumber technology advancement, and many other things. But despite this, these challenges and these roadblocks, agencies are finding ways to break through. And I'll give you an example. Health and Human Services has done a great job with innovation, and in particular there's a program called the TransNet program. And what this is, it's really a transformational solution to a paper-based process that basically located and tracked vital organs across the country. So essentially, using mobile apps, tablets, and a barcode printer, they were able to take a prototype and move it from a concept to simulation in 4 months. This is really impacting how people's lives are affected. And really it gets to that end user experience is really changing. And the government's leading in many ways. One of the things the VA is doing is really kind of consolidating how they get their messaging out and include people in these new technologies and access types of mediums. And my own brother, of course, is a veteran, and they're very much attuned to what the VA is doing for them, and they feel like they are really, being in the forefront of putting out new technologies in front of them to really move them.
I think too, in the private sector, there's reports continually about that the patient feels more cared for because they have access actually more to the physician or the clinical nature of what they need than they did before. So they actually feel more cared for, especially the vets. I do have vets in my family, and they have the technology in their life, and it feels like for them that someone's taking care of them.
Not to overuse the word, but really makes them feel more connected, but almost in a physical way to their caretaker, right?
Absolutely, and all the way down into the children's health, the technology is really kind of permeating how they're cared for.
So in order for us to be fully digital, right, in a fully digital world, it's got to be easy, it's got to be simple for people to use. How does that translate into this subject that we're talking about in terms of healthcare?
So I think that I would add one more, which is connected, right? So it really, all the disparate pieces of information, which you as a patient might have, has to be connected to the entire ecosystem. And that's where the future's moving towards, is this, okay, we've got all these silos, now let's move into a very connected world, not just a mobile or a care anywhere world.
Peter, your thoughts?
Well, I think the important thing for agencies in the public sector that have to deliver services is that they have this real end-to-end view of that ecosystem, and that they not only can connect those dots seamlessly, but they can manage the security of it along the way in every step, and that's absolutely critical.
So let's talk a little bit about where we're going. We've talked a lot about where we are today, which lends itself to tomorrow, but paint me a picture of what tomorrow looks like in the world of healthcare, connected, digital, streamlined.
So I think when you talk about that future, and I don't have the crystal ball, but as we're moving towards a more connected ecosystem, and I'm going to take it from a private sector, not a public, I'll let Peter do that. On the private sector, it is so disconnected in most cases. You'll start to see so much consolidation of information for the decision support to make a difference in a patient's care. And that's really the future of it, is that all this information will start to become part of the patient's record. And then that record then can be used to really take care of the patient.
So less of a reliance on having your records moved from doctor to doctor, but everything about you stays with you.
Where you are, wherever you are, yeah.
Peter, how about in the federal space?
Well, very similar in public sector, healthcare. One of the problems is the facilities have a tough time really reaching all the patients. So how do you bring the facilities to the patients? Well, that's what the VA is doing with their mobile health provider program. And it's absolutely changing. If you think about it, if you're going to a clinic once a month or once a week, you have a conversation that's only so long, and that interaction is even less. And now you have the ability to do that, whether video or audio, as much as you need to. And so a lot more information gets discussed and alternatives get talked about. It just truly changes the nature of healthcare.
The physician learns more sooner and can make an informed decision because they understand the context of everything else.
Mm-hmm. And I think one of the unique things about this entire discussion that we're having here today is we're talking about people, we're talking about their well-being, we're talking about their lives. It's our parents, it's our grandparents, it's our veterans, it's our neighbors, our brothers and sisters. Yeah. Talk to me about that impact.
So I think, and I'm glad you said that, because it's really what makes the difference is the whole story and the whole care, what we would call the care continuum, that makes a patient's life better, easier, or more connected into the healthcare system. Because you aren't, normally you're never by yourself in this journey. Your family and your caretakers have to be included in all of that. And that becomes the social part of medicine, which is starting to shift using social media, different sites that really connect the whole entire community.
A lot of things there that we could spend a lot of time on, but unfortunately that is all the time that we have for today. I'd like to thank my guests, Nancy Green, Verizon's Global Healthcare Practice Lead, and Peter Pinn, Verizon's Regional Vice President of Civilian and Public Sector Markets, on healthcare in the public sector, sponsored by Verizon Enterprise Solutions. I'm your host, Jason Fornicola, and you're listening to federalnewsradio.com and 1500 AM.